Hey, what's going on, good people? It's your boy James Harris, of course, Mental Heal. Listen, I appreciate all the support over the years, whether it was for my book, man, Just Express Yourself, which is an interactive planning guide for boys and men to better express themselves. So salute to those parents who got it for their young sons. Praises to those partners and couples who got it for the men in their life. Of course, to the schools, the administrative, and everybody else who ordering the book by the dozens. I definitely appreciate that. And also salute to everybody who supported me on Cheesy Date Board Games, which is a good game for adults and couples, your game night, your date night. So many interactive ideas come from it. I definitely love the responses that it's garnering. But now I'm asking for your support again on this YouTube journey. I'm back. I took a little break because I had so much going on, but be a little bit more consistent with it. I got a couple interviews lined up with prominent people and people doing phenomenal things within the community or within this mental health space or even different authors and things like that. So bear with me. Appreciate your support. So make sure you like, share, and subscribe. And the guest that I got coming up now is. Oh,
How you doing? My name is Kwadwo Adu-Owusu-Akyaw. I'm an orthopedic surgeon at OrthoVirginia here in Richmond, Virginia. I focus on sports medicine, so I treat athletes who have injuries of the hip, knee, and shoulder through either surgery or non-surgical methods to try to keep them moving.
yo, that's so wild, man. How'd you get to be a orthopedic? Like, what got you in that line of work?
Man, I tell you, it was really sports medicine that got me there. You know, I've always noticed how sports integrate so closely with communities. And it was important to me to use my profession to give back to the community. And I saw the intersection between sports. With the orthopedic side of thing, the orthopedics is more generally, like surgery to fix bones and joints. And so that spoke to me as something that you do really hands-on. It's really a hands-on thing that I enjoy doing. But I think the sports medicine really augments that and plays into that. So I think the two really came together between me wanting to work with my hands in surgery, but then wanting to contribute to the community in the same way that sports medicine does.
I got you. So, how'd you decide to do the sports side of things opposed to the geriatrics or like pretty much anybody else? Like, what made you specifically choose the sports route?
Yeah. It was just it created an opportunity to really integrate with the community I was in. So at the time, I was in Durham, North Carolina, doing my residency in orthopedic surgery, and we were tasked with taking care of some of the local high schools. So we got to choose what high school we wanted. I said, give me the blackest high school, pretty much is what I said. And you could see the effect that you have on these young people being a sports medicine doctor. In a lot of situations, you're the only doctor some people are interacting with. So you do a preseason physical or something like that. You might be the only primary care quote unquote doctor seeing them. You might be the person who might find they have a heart condition. You might be the person that finds out they have, makes them think about their asthma more closely or something like that. So, even though it's orthopedics, the sports medicine side of things really made it a more global community health, situation. And that's what really spoke to me. I know our older brothers and sisters, they really need a chance to keep moving. And orthopedics does a lot of that in terms of like hip replacement and knee replacements. But I felt to me, my personal calling was probably more for the younger active side of things. And that's where sports medicine came in.
I got you. So on the topic of sports medicine, though, like it seems now, it appears to be more and more athletes, specifically, if you want to just stick to basketball and football, like more and more pro athletes seem to be getting injured more. Like it's so many good players, NBA side got that ACL tour or that MCL or or the Achilles, and then of course same thing for the football side of things. So how come it appears to be an increase in sports related injuries?
Man, that's a complex question. I think if you look at the highest level of performance, athletes are becoming so much more explosive, right? And the power which they play is so much higher than it used to be. And I think there's some theories that it's possible that our ligaments just aren't keeping up with our level of explosiveness. That's one side of things. The other thing that comes into question, and this is maybe less so for the elite athletes and more for the day to day, is a question of adequate strength to protect the joints that you're working with. So I'll give you an example. So if you take it down to the youth sports level, we're equally seeing an epidemic of ACL tears in young athletes under the age of 18. And we think that has a lot to do with over specialization. So, back when you and I were growing up, we go out and play. I mean, you play sports, but you go out and play and do all kinds of different things. And those other activities were developing different aspects of your strength and your coordination. But now there's a tendency, at least for some, for young athletes to start specializing in sports right away from a very young age and playing the same sport year round or almost year round. And between the increased load of playing that same sport and then not necessarily getting the coordination and strength side of things, we think that's contributing to the pandemic of ACL tears. And then, it kind of translates as you go up the lines, people get older and older. So I think it really starts honestly from the beginning.
No, I mean, I definitely can see that, man, because you get this young person playing AAU early, middle school age, and then just year after year, road after road. That makes sense, by the time they do without that formalized development or strengthening everything around that. So that does make sense. I guess it is one of those things that people don't really look at while you're doing it. And AAU has increased overall the last 10 to 15 years because when I was growing up, it wasn't like a weekly trip. You like now his parents is going like, the Carolinas, the Georgias, the Floridas, and
Weekend,
all,
Friday through Sunday.
everywhere.
Yeah, yeah.
Yeah, so it's becoming like a serious thing. So what are some ways, I guess, that we can reduce or mitigate those injuries from happening, not only on the professional side, but from the youth side as well? Because I know it might be hard to tell your young person to, hey, slow down, not this week, because they want to compete and perform and be the best within that regard. But getting this information from you, knowing like, hey, if you keep, overusing it before it even develop or strengthen the way it needs to, it's probably going do something that we don't want it to do later. So how can we, I guess, educate them on that or just change the dynamics of how it can shift?
Yeah, no, I think you made exactly the point about changing the dynamic. We have to change the culture around sports training and really sports education. And a lot of times, the boring stuff is the important stuff. I mean, if you use a financial analogy, like investing is supposed to be boring if it's going well. It has to be exciting, right? So this is like that. We have to find a way to culturally shift the concept and make it cool to focus on injury prevention. So there's a lot of talk about performance when it comes to sports. Who wants to perform the highest? You want to get your 40 time down, you want to get your vertical up, everything like that. We need to, in that same breath, really bridge the gap to allow young people to understand that the basic strength training, the plyometrics, the coordination, the skills, or is what's going to keep them playing longer. And ultimately, that injury prevention is their power. So if you think about like the timeline of when one goes, throughout the youth sports and tries to go on to say college, which is now professional effectively, right? And
Mhm.
then next level professional, you being injured effectively weeds you out of that process. I mean, like it or not, people who are getting injured at the youngest ages, before the age of like 14, 13, 14, generally speaking, you're going to have a hard time making it to the next level, right? So if we change the concept and say, well, you don't necessarily need to be training at all, times of the year in your specific sport, you need to take time to recover and to rest. And we need to emphasize and make that cool. You need to take time to invest in your coordination and your strength so that when those potential injury situations happen, your body can compensate appropriately and doesn't end in something devastating that throws you off your pathway. So I think it's a real cultural paradigm shift we have to make.
No, definitely, man. And I think one of the misconceptions that people tend not to look at is that rest factor. Like a lot of people don't believe that they should rest or increase the amount of rest that they're getting and recovery. They feel that they got to go, 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 go. Not just from a sports standpoint, but just from a daily, work rest ratio standpoint. A lot of people feel that they got to go. So whether it's capitalism or just wanting to be the best or just not knowing the education side of things. So I definitely think it needs to be a culture shift of that dynamic as far as pacing yourself and growing. So within your line of work, what are some of the common complications to different surgeries that you do? Because you mentioned hips, you mentioned knee, and so many other surgeries. So what, like, are there complications to those surgeries?
Yeah, they definitely can. That's why we try to make surgery a last resort. So I'll use ACL as a common example. Most people are familiar with ACL surgery, or ACL as a concept for young athletes. So, it's generally very safe, but things happen. So you're under general anesthesia, so you're completely asleep. And during that process, there's always risks that come with that. It's very rare for someone to, for instance, like pass away from general anesthesia. That's exceedingly rare now. But other things can happen. So rarely, things a little more serious, like strokes and things like that can happen technically. More commonly, a lot of people will get like nausea and vomiting that can last sometimes for days. And that sounds like not a big deal, nausea and vomiting, but you'll have people who, can't eat for days at a time after general anesthesia. And that's just because their body reacts to the medication. I say all that to say is I think societally we've kind of made anesthesia like not a big deal. And we need to kind of just remember that this is a serious thing we're doing, even if it's a quote unquote small surgery. Other complications for ACL. So we worry about things like blood clots. If you may be familiar, sometimes the blood in the back of your leg can clot and form almost like a ball of just thickened blood. Um, and you have a higher risk for that if you have any sort of surgery, especially to the leg. So ACL being a big one, a meniscus. If you're talking about an older patient, a total knee replacement, all those surgeries are going to have a higher risk for a blood clot. And why that's dangerous is those blood clots can leave the area behind your leg and go through your bloodstream to your lungs. And then that can cause a serious problem. At that point, it's called a pulmonary embolus. And that can be deadly. So, in most cases, we have patients do some kind of a blood thinner. Maybe it's just like aspirin or something like that, right after surgery to try and prevent that blood clot from happening. Um, One big thing I always talk about with ACLs, and this is a risk factor whether you have surgery or not, but this is important to keep in mind. ACL injury has a higher risk of developing arthritis later in life. We call that post-traumatic arthritis. And that risk is there whether we do surgery to fix your ACL or not. That's an important thing to keep in mind. So the way we can think about it is the ACL tear is such a traumatic injury to the knee that it's almost like the cartilage in the knee recalls that trauma, that scar, so that even if it's not immediately damaged, it accumulates damage over time. And so that's why it's so important that we try to prevent these injuries as much as we can, because that ultimate complication of post-traumatic arthritis has long-term effects on the patient's life. So you're thinking about limitations to your potential movement as you get older, limitations to your occupation, limitations to your quality of life, and then the need for potentially for some people to go on to need a knee replacement on account of them having the ACL tear in the first place. And so I would say that's one of the biggest complications we don't talk about, is how that initial ACL tear, surgery or no surgery, increases your risk for arthritis later, therefore limiting your movement, leading for increased risk of metabolic disease. So being overweight, cardiovascular disease, stroke, anything like that, hypertension, because of a lack of movement. So I think this is a key one to keep in mind.
No, I got you. I appreciate that explanation, and it was a thorough one as well. But speaking of the anesthesia portion of it, like, you in Richmond too, so you probably know this. It's not a lot of anesthesiologists in these hospitals, so I don't think that's just on a Richmond or Virginia level. It's probably nationwide. So if it is a limited number of anesthesiologists, like, what should a person do in that case? Like, because I guess they got to go from hospital to hospital. They're probably in demand and all that. So if a person can't get the anesthesia in a decent time frame, what should they do then?
Yeah, yeah. I mean, fortunately, unfortunately, there are extenders who work with anesthesiologists to increase the number of providers available. So there's a profession called CRNA, which is a nurse anesthetist. So someone who initially went through a nursing background, but then went into school for anesthesia. And a lot of times, I'll say most times, these CRNAs, these nurse anesthetists, are the ones actually performing like the step-by-step procedure if you're receiving anesthesia. The anesthesiologist recently or these days tends to be more overseeing the actions of these nurse anesthetists. So therefore, you need less anesthesiologists. You have more of these nurse anesthetists who are doing more of the day-to-day of actually taking care of you during anesthesia. But you're absolutely right. I mean, there's certainly shortages for them too, and that creates kind of a bottleneck that people getting surgery on time if they need it. So it's definitely an issue. I think the hospital systems locally and across the nation are trying to do their best to support, CRNAs and what have you. I think the some of the recent stuff that's come out about what's a professional degree or not in terms of nursing. I won't get too deep politically, but I think that's not going to help us because that's therefore limiting the amount of providers we're going to have to care for our population. So, we got to be careful that we are thinking about the future.
Yeah, no, I mean that list of providers who they want to shift the change of professions was an ignorant one, and of course it boils down to money, and the ability to obtain certain funding for school.
Right.
But yes, that's ignorant. That's a whole different segment. But I'm glad you was able to touch on it.
Yeah.
So, but back to the like replacements. I'm sure now it has increased from like maybe 10 to 15 years ago when it was like replaced with metal or some type of variant that would corrode within people's body. Now they got silicone and so many other factors. Like, has it increased from from back in the day? I'm sure it has.
There's been some changes. Um, I would say that the fundamentals of, for instance, like a knee replacement or a hip replacement, they're more or less the same, but some of the materials have changed. Um, with both of those, typically there's, if you think about the knee is a hinge joint. And so if you replace the femur and the tibia, those two sides of the bone are replaced with effectively metal. But in between goes a liner that's called a poly or polyethylene. And advancements in that poly have increased the longevity of the replacements. So that's the part that tends to run out or wear out over time. And so increasing technology has made that more reliable, so it's less likely to wear out. So that's where the big changes has come. But I would say in the last 15, 20 years, I don't know that the fundamentals of replacements have changed fundamentally. I think what's changed is our mindset around it and kind of moving in more of a direction of how do we prevent people from having to have this in the first place. And so that's where things about preventing post-traumatic arthritis, like I said, that's where discussions around, for instance, like platelet-rich plasma and stem cell injections. Now, I mean, that gets controversial. We touch on that more, but that's why it's increasing so much popularity because the question is, how do I preserve my joint as long as I can, rather than just waiting until I replace it?
Yeah, so speaking of prevention, and you just touched on the two things that I definitely wanted to bring up because I remember I had stem cell replacement. You remember I
Oh, you
texted you
did?
a couple
Yeah,
months ago.
yeah, yeah. That's right.
Like,
Yeah,
hey,
yeah,
bro, give me the rundown. How you feel about this?
yeah.
So you was able to do that, and I'm gonna tell you, I got stem cells in my knees. Best thing I've ever done, man, because I had day-to-day pain. Now, like no pain. I'm back to running outside, inside, treadmill. I'm back doing kickboxing a couple days a week. So it's literally no pain. Like at a minimum, I was like, yo, if my day-to-day pain can just go away, I'll be fine. I'm cool with just walking. Cause like literally I had pain day to day all day, just ache. But getting stem cells she, bro, listen, it's a difference. I'm happy I did it, but can you
Good.
educate the people on what is the stem cell replacement and or the platelet-rich plasma placement procedures if they too want to be educated on those things?
Oh, for sure. Yeah, I remember when you texted me. I'm glad that worked out. For sure. So when we talk about it, we tend to put them into a category called orthobiologics. And the reason why we use that category is technically speaking, we can only use the term stem cell if it's something that's going to regenerate tissue per se. And these cells don't necessarily do that. So that's why FDA wise or whatever, technically speaking, we don't use the term stem cell as much. Although when we're talking about it, that's all good. Um, so PRP and then what we're calling stem cells, all that fits into the same category. And the thing that I want people to really understand, and you and I talked about this, is be careful about someone trying to sell you on a stem cell is going to grow back your cartilage or grow something back because nobody has that. The biggest thing those treatments can do that we understand from the studies is that it decreases inflammation effectively for a lot of people and safely in a way that, for instance, like a cortisone or steroid shot does the same, but may be more damaging to you long term, right? And where this tends to be your own body cells Basically, we're trying to help it to not repair, but trying to decrease the inflammation. I like to say it almost changes the environment of inside the joints from a traumatic situation to a less traumatic situation, from a catabolic breakdown situation to more of a rest and recovery. And that's where you see the pain relief when the inflammation goes down. And so I always tell patients, like, if you're going to do this kind of thing, you have to go back to your strength training, just like you said, go back to your strength training. Because if you just do a shot and think I'm done, that's not really going to do it. You got to use the time that it bought you with the inflammation, then build strength, and then remain active on that joint.
Yeah, nah, that's definitely true. So I took 3 months off and I was just doing walking. I wasn't running.
Hmm.
Although the person who did my procedure, she said, "Yo, you can start back running if you feel discomfort, just dial it back." But I was like, "Nah, let me just maximize it. Let me just sit out for 3 months." I ain't do kickboxing. All I did was my wife and I would walk. We probably walked up to about 5 miles. Because typically I run, that much. So I was like, well, let me just dial it back just so I wouldn't waste money on getting this procedure because, like you said, since it's not FDA approved, insurance and coverage, so I had to pay out of pocket.
Hmm.
But it definitely was a good decision. But now, just looking, let me see, I think I had it in May, so just looking back, man, like my day to day comfort level is good. I'm back squatting, leg raises, extensions, all those other things, in addition to increased cardio. So it definitely feels way better. Um, so long term wise, you think more and more people, or realistically, do you think the FDA will ultimately probably try to approve it so more people can benefit from it, or do you think they want to continue to keep it distant so they can continue to have people get replacements?
Yeah, I think it's a good question, man. I think that with time, as studies continue to increase, the FDA is a little bit of a harder thing, but insurance is another question. So it becomes a question of FDA approval, which some of the stuff, for instance, like PRP, or platelet-rich plasma, is generally speaking approved. But then the other side is insurance. Will say, because the insurance is always behind, they're always lagging behind. Even though there's studies that support it, they're not necessarily trying to pay. But I think there's going to come a paradigm shift where it'll become apparent that it's less expensive to use these more non-invasive treatments, like injections of these orthobiologics when it's appropriate, than going through the whole thing of surgery. You got to think about the cost of surgery to the person and to society. So, I mean, it's not just the cost of you having the surgery that you pay, it's the cost of that metal implant if you're doing a knee replacement or hip replacement. It's the cost of anesthesia. It's the cost of the time in the hospital, whether you stay a day or 2 days. And then it's the cost of your lost productivity, what you can do during that time when you're recovering. So that's like, if you take all that together, and we're talking about, on the billions of dollars order across the nation. If we're talking about that. So if we just take a small percentage of that and improve that such that, you're having, as you're functioning better from doing this less invasive injection, then you've helped not just the person, but society, astronomically. So I think that's where the paradigm is going to go eventually. So to long answer to your question, I think yes, it will go in that direction with time.
Yeah, I mean, because even with surgery, just the downtime, if you were to get a knee or hip replacement, like you
Yeah.
immobilized. But again, when I got these stem cells, the same day I was out still running errands and living. So that to me, was definitely one of the benefits of it. Just no recovery realistically, just take it light if you feel discomfort. But I think that definitely was one of the beneficial sides of it. So I do hope the insurance companies catch up. But of course, everything is always going to be suggestive and things like that. What are some other tips though that you think you can leave for the people who might be troubled with arthritis and or joint aches and pains? Like, is there anything that they can do to reduce that pain on a day to day outside of getting these procedures or replacements?
Yeah, yeah, no, I think everybody needs to kind of take these few kind of key points with them when it comes to talking about arthritis and joint pain. The biggest mistake one person can make is to stop moving. And I know there was in the past, it's kind of been preached, go sit yourself down. Your knee hurts, go sit yourself down. And I think that's very prominent in a lot of cultures, including our own. But the joints are kind of a use it or lose it situation. And so I tell people all the time, you know, that you are doing yourself a disservice if you stop movement in the setting of arthritis, because then you're going to increase or at least speed up the spiral downhill of lack of movement. When we talk about arthritis, a lot of times we talk about the cartilage in between the joint. And when someone has the end stage of arthritis, the end of the line, we say bone on bone. I know people have heard that term, I'm sure. All the cartilage is gone, the bone's rubbing on the bone. And so it's been thought that that means, okay, I can't do anything until I get a knee replacement. But that's not true. So I have patients in my own clinic who are jumping around, literally, I kid you not, doing backflips with bone on bone knees and hips. And what they do, they kept moving and they built the strength up in their joints so much that it supports the joint enough that the inflammation is such that it doesn't bother them. And so I have people in their 70s, dance instructors, jumping, twirling, doing the whole bit, demonstrating no cartilage in their knees. So I think that we have to shift that paradigm and keep in mind that movement is medicine in this situation. The next thing I'll give you is weight optimization. So there's a statistic that says for every 1 pound you lose, you're taking 4 pounds off of your knees. So there's a inherent connection between being overweight and having joint pain. We know that's related, not just from the weight, but also because the presence of fat in your body increases inflammation in your body, period. So it's two things that's hitting you there. So decreasing that weight, optimizing that weight, but whatever method you can, even if you have arthritis, can then increase your mobility and then leads you again to be in a situation where you can keep moving even if you have arthritis. So I say all I have to say is most people who come to me and they have the initial signs of arthritis, I'm sending them to physical therapy. And I'm saying, I want you to go there, let them teach you the specific exercises, how to strengthen your gluteus muscles, how to strengthen your core muscles, how to strengthen your quadriceps muscles, your hamstrings around the leg safely to support you so you can keep moving. And I want you to think about this as like part of your daily medicine. This now has to be like brushing your teeth, even after you finish physical therapy. If you can make that mindset change, not everybody's going to avoid the replacement, but I think more people would if we could go down that mindset instead.
So for the people who out there saying, "Man, I don't have cartilage and it does hurt," is there any hope for them to be able to regain cartilage or like insert some cartilage?
Nah, unfortunately, no. Unfortunately, no. We have some technologies for like if you have like a small area of cartilage that's missing. So I tell people when you have full blown arthritis, it's like think about like a road. The whole road is gone, has to be resurfaced. As opposed to people who have little cartilage defects, which are more like potholes. Now we have technologies to fill in potholes of cartilage in the joint, and so in that situation, you could come back from it. But if it's to the point where it's arthritis, where the whole joint has pretty much eroded away, there's no way to put cartilage back, unfortunately.
Okay. All right, got you, man. So before I let you go, man, any last minute tips? What would you leave these people?
Yeah, man, I'm going to emphasize back on the prevention is power thing. That's one of my big things between my practice and our social media presence. Uh, really just emphasizing the importance of community involvement and ensuring that young athletes remain safe in playing these sports and just keeping in mind how important it is to our community, right? That young people are not suffering these debilitating injuries at such a young age because we have to think about how that's affecting our community and society at large across the board. And so we really need to change the paradigm and change the culture to emphasize injury prevention everywhere we can.
Got you, man. So for the people who got additional questions or want to come see you, what's the best way they can do that?
Yeah, so I can't really answer medical questions online like Instagram. However, I can make contact with you that way. And if you have a question, I'm happy to then connect you to our clinical staff who will then facilitate either if it needs to be an appointment or if it just needs to be a simple question and answer, that's fine. But I'm happy to have people make contact with me via the Instagram. But in terms of medical advice or anything like that, we have to go through the official channels.
Got you. That's understood. So go ahead and drop your information so people can make that connection.
Yeah, so my Instagram is drdr.o_for the 804.
Gotcha. Hey man, appreciate you for coming through, blessing us with your knowledge. This insight has definitely been helpful. And again, when I was going through my preparation for my procedure, you definitely was one of the first ones I reached out to because I know you was in the field and I know you would give me guidance on how to obtain certain information. Like I did a lot of research on my own, but I wanted to ensure that, you know, I was getting that second opinion. And I definitely appreciate you for that. So, hey man, keep up the good work, keep doing what you're doing, and I'll catch you on the next one.
Likewise, blessings, man. I appreciate you.
Yes, sir.